Good morning. I am Dr. Manisha Ghosh. I am an anesthesiologist and I work in Thane, Maharashtra. So I have been an anesthesiologist for the last 30 years almost, and I've been very lucky because anesthesia is not only my profession, it is also my passion. So being anesthesiologist means everything to me. The day I don't go into the OT, my mood is very different, and my family always says, "Arey baapre, tum OT mein jao, you will be happy there." So I'm a totally urban anesthesiologist. I have always lived in cities, and coming to rural areas has been either for a recreational purpose or for surgical camps. So when we come with the impression that we are going to have very limited resources. But whenever I've gone to any rural settings, it has been a very, very pleasant surprise. The limited resources are only in the thing that there is no tertiary care center available and there are no blood banks which are close by. Otherwise, OT per se, we have everything in the OTs that we would have in a good nursing home or a small hospital setup even in the cities. So whatever rural settings I have visited, I have had no complaints as regards the OT. They have been very well equipped. So I have been brought up in that family setting where we were not very rich but not very poor either. But what was already always taught was like charity begins at home. So first, for many years of my life, I put my family in order, made sure that my children got a good education. And then when actually too late in life, when I came into my 40s and early 50s, I realized that I am not doing any social service. So this has been a part of my intention that I should come to some rural area or wherever there is requirement of an anesthesiologist and give my best to the society. So that was my only intention. You can call it selfish, but in that I am also doing a little bit of myself to the society. So this is my first journey with TSF and I am just learning. So all the patients who come here are from extremely poor background and they are all like daily wage earners or working in their farms, and because of the pain and the disability that they get because of this disease, they find themselves very restricted even to do their everyday work. So they come with a lot of hope and we give it to them that after the surgery they will be better and they will be able to do their work properly and in a better way than what they were previously doing. So we have operated yesterday and I have operated today, and the feedback that we get from surgeons actually is our biggest feedback, because we work for 2 days and then we go up only to come again after maybe 3 months or 6 months. But we get a lot of feedback from the surgeons that patients are doing well and they are happy and they are able to go about their work. So per se, as of now, I don't have much experience, but from what I have got the feedback, like I said, TSF is a very well-known and a very old organization who has been doing yeoman service in the rural settings for many years. And obviously, since they are coming again and again, that means patients are getting greatly benefited. So one patient is our biggest spokesperson, I feel. So he will go back, he will say, ki, see, mujhe bhi, I had the same problem and now it has been rectified after the surgery done by TSF, and that motivates more patients to come. So I think our patients are our biggest spokesperson who bring other patients having similar problems. So that is a very good thing. So like I said, after I crossed, I came near my 50s, I realized that I should be doing some social service. And in that I have gone to about 4 or 5 camps in the last 2 or 3 years, and every time it has been to a different place. And every place has given me a lot of joy and I feel very happy working on them. Same I have felt with TSF in this last 2-3 days, and I do see a long association with this team in the near future, yes. Definitely. It's a wonderful organization. It does a lot of good work, and especially people living in urban areas, doctors practicing in urban areas, I would seriously request them that for at least 2 or 3 days in a year, they should come to some rural setting, come with TSF, do good quality work and go back satisfied. Ending note from one side is actually that board that you see over there, and I'd be very happy if you capture that one also. So what it says is it is much more important to know what sort of a patient has a disease than what sort of a disease a patient has. So one has to analyze the patient, touch him on a human level, and then many times many things are psychosomatic, because they are not mentally well. It manifests in some sort of physical illness. But talking to the patient, understanding them, counseling them, knowing their problems can solve a lot of problems. So I think that is a very good message by William Osler that one should take home. Thank you very much.